Okay, today I am presenting a 28-year-old female seen in our primary care for a regular menstrual cycle. She had some weight gain and was ultimately diagnosed with polycystic ovarian syndrome, a condition that was challenging because she had this overlap of reproductive, metabolic, and endocrine possibilities. So that's what I'm going to talk about next 5 minutes. Subjectively, she reported her periods were irregular, occurring every 2 to 4 months. Her last period was about 10 weeks ago, and she has been seeing this progressive weight gain. She does some Zumba. She says most days of the week and takes pretty good care of her diet. So she was very frustrated with that. Along with that piece, she also has some weight gain, acne, and facial hair along her chin and her neck and a little bit under her nose there. She's sexually active. She's not really using contraception. Her partner withdrawals. And she was just expressing some concern about everything that she had going on. She does have a history of type 2 diabetes in her family with her mom. And her lifestyle, for the most part, she's a second grade teacher, but she describes it as being rather sedentary and limited with physical activity. Objectively, her BMI was 32.1. She had some notable findings, the hirsutism, acne. She had the actinios nigrius on her neck, so maybe some insulin resistance going on there. And then her pelvic exam was unremarkable. Pregnancy test was negative. Labs and imaging were ordered to confirm the diagnosis and rule out any endocrine disorders. Those are pending as of now. And assessment-wise, the primary diagnosis is polycystic ovarian syndrome. We based that on the Rotterdam criteria, given her oligomenorrhea and clinical hyperandrogenism. She has some differentials, including thyroid dysfunction, hyperprolactemia, and less likely adrenal or neoplastic causes. So that kind of her ruled out differentials there. Our plan is to focus on both symptoms of management and long-term prevention with the patient. We initiated combined oral contraceptives for cycle regulation. Ordered some metabolic and endocrine labs, and recommended some weight loss target goals, maybe 5 to 10% of her current weight over a year, to see how that's going, and then also some education on fertility and diabetes as well, cardiovascular disease. Planned follow-up for her is in 3 months. She'll see us again. In a reflection, let's see. She a little bit challenging because it's both reproductive and looking at chronic disease prevention as well. In the case, I guess, required a very holistic view of her lifestyle. So that was probably the challenge of it all. And then making sure that we're comprehensive and addressing all of the integration between the hormonal, metabolic, and psychosocial care as well with her, as she is really definitely trying. So it'll be interesting to see how she does once we follow up with her in 3 months. Thank you. Mm-hmm.